Healthcare data types. This session introduces critical categories of sensitive health information. Understanding these categories is important in the management of healthcare data security. There are three key healthcare data types: PI, PHI, and EPHI, each with specific sensitivity and regulatory importance. Proper classification of healthcare data affects how data is stored, accessed, and protected under legal and technical safeguards. Regulations like HIPAA and PDPA depend on data classification to ensure privacy and avoid breaches. HIPAA, or Health Insurance Portability and Accountability Act, is a U.S. federal law enacted in 1996 that establishes standards for protecting sensitive patient health information. PDPA, or Personal Data Protection Act, is a Singapore law for the protection of personal data. Ethical handling of healthcare data is important in that it builds patient trust and supports secure healthcare delivery. Personally identifiable information, or PI, refers to information that can identify an individual. In healthcare, this includes names, NRIC numbers, addresses, and contact details. PI links administrative processes with clinical systems, enabling identity confirmation, appointment scheduling, and billing management. PI must be protected through access control, encryption, and staff training to prevent identity theft and comply with regulations like PDPA. PI becomes highly sensitive when linked to medical data, demanding strong governance and awareness in healthcare settings. Protected health information, or PHI, is health-related data linked to an identifiable individual. Examples include medical diagnoses, prescriptions, and treatment records. PHI reveals intimate health details. Exposure can cause stigma, discrimination, or distress. Access to PHI is role-based, with secure storage and policies to maintain confidentiality. Electronic Protected Health Information, or EPHI, is PHI that is created, stored, or transmitted electronically, such as electronic health records or lab systems. EPHI enables faster access, better care coordination, and advanced analytics in healthcare delivery. Electronic systems with EPHI face threats like hacking, ransomware, and phishing attacks. Hence, encryption, access controls, audit logs, and secure transmission are required to protect EPHI data. The Singapore National Electronic Health Record, or NEHR, is EPHI. The patient data in the NEHR include patient demographics, admission and visit history, lab and radiology results, medication history, procedures and allergies. The Singapore Ministry of Health has strict requirements for access to NEHR. These include use only for direct patient care, no employer nor insurer access, MOH-authorized accounts, role-based access, two-factor authentication, audit logs of every access, patient can view access history, multi-layer cybersecurity, regular pen tests and audits. PI, PHI, and EPHI contain varying sensitivity levels requiring tailored safeguards to protect patient information. Proper classification of data helps healthcare organizations comply with legal requirements, avoiding penalties and reputational harm. Understanding data types supports ethical treatment, patient trust, and efficient healthcare operations with clear protocols. Knowing data classification guides appropriate breach reporting and mitigation strategies, reducing impact and risk. Understanding these data types helps healthcare organizations protect patient privacy and comply with regulations such as PDPA and healthcare data protection laws.